Alzheimer's can be reversed through lifestyle. And so the big
Okay, say that line again. Alzheimer's what?
can now be reversed.
Christine Carter, welcome to Diacardia, the podcast that's dedicated to building strong relationships and strong individuals by speaking from the heart and by listening through the heart. Welcome.
Thank you. I'm so happy to be here, Dan. Thanks for having me.
Christine is a social psychologist. If you want a quick reference, go to the Greater Good Science Center, search for her there, where she has a huge number of articles and where she takes, which she will do for us today, right, Christine? She will take complex issues and complex research about the brain, and she translates that into really practical advice for parenting. You've written a lot, and you're a great public speaker. And you've also had to walk the walk. And one of the things I thought it would be great for us to talk about would be medicine. When I was growing up, and until a few years ago, medicine was the stuff in the medicine cabinet. But you, as a social psychologist and as a coach, as you point out, a great coach, are interested in a different kind of medicine, which we now call lifestyle medicine. So why don't you frame that? What is lifestyle medicine exactly?
Yeah, lifestyle medicine is the prevention and treatment and often reversal of chronic disease through lifestyle. So things like how much we move or sit during the day, what types of foods we eat, whether we have purpose and meaning, how socially connected we feel, how we manage stress. Did I say sleep? That's a really big one, right? There are these big categories of things that actually, what I love about lifestyle medicine is that we have a lot of control over aspects of this. And so one of the things that
Can I stop you for a second? Yeah. Because you're a researcher and a scientist, and you just said lifestyle medicine can help us even reverse chronic disease. And so I don't think that way, Christine. Like chronic disease, when most of us hear chronic disease, we think, okay, how many months do I have? So is there really research that lifestyle medicine, changing what you eat, what you drink, how you work, can reverse chronic disease? Like where does that happen?
Absolutely. Fix your sleep, have all those things. Yeah. Not only will you feel a lot better, will your quality of life go up, which is, I came to see as being the most important thing. But yeah, like all the big chronic diseases. Now a big study was just released. Alzheimer's can be reversed through lifestyle. And so the big...
Okay, say that line again. Alzheimer's what?
Can now be reversed through lifestyle.
What are the key lifestyle indicators in that survey? What are they studying in that survey of lifestyle medicine? Who doesn't want to know, even if we can't remember, what reverse Alzheimer's?
But what if you were diagnosed with Alzheimer's? I mean, they do have physical measures, but a lot of it is just cognitive, right? You're doing these cognitive tests and you either can tell time or you can't, right? And then if you can't, and you think it was a 9-month trial, took longer than, it wasn't instant. And it's very rigorous, like the amount of movement in this particular trial, the type of food that you eat was very rigid, right? But if it reversed your Alzheimer's, would you do it? Yeah, most people would. Most people would. They would give up Diet Coke or whatever it is, like whatever your vice is. No, I'm just teasing you, Dan. But you don't have Alzheimer's, right? So the other big, cognitive decline, cancer, and cardiovascular disease.
And you're focused on breast cancer. You are a breast cancer survivor now. You're in remission or whatever is that correct?
Yeah, breast cancer is a little bit different than other cancers in the sense that that you go through what they call active treatment, which is surgery, chemo, radiation, those kinds of things. Depends on the type of cancer that you have,
Right.
what of those, and then you kind of graduate from that, and they call you a survivor. And for 80% of breast cancer patients, they put you on an endocrine therapy, which blocks all your hormones. And it is horrible.
Uh-huh.
So the worst side effects for me by far came from this endocrine therapy. It's like menopause times 1 billion. And so immediately I became diabetic and had pretty like almost crippling arthritis. And it like the side effects are very profound. I couldn't sleep. I didn't have, it was really something. And the only thing that the traditional medicine, well, this is now a part of traditional medicine. You can be board certified as an MD in this, but my doctors really the only thing that they would do is offer me more drugs, right? So a sleep aid, um, but then I would say like, okay, well, I took the gabapentin, but like I know that you guys call that the stupid pill, and I really feel it. And I was already having problems with like when you have no estrogen, your brain actually shrinks measurably and your memory starts to falter. And I was already having problems with
Ah,
focus
yeah.
and brain stuff, right? And
Right.
so as I can't come up with the word,
Right.
um,
Right.
um, uh, anyway, so they're like, okay, well, you should definitely be on Adderall, right? So take gabapentin at night and Adderall in the morning, and metformin 3 times a day to help control your blood sugar. And it was just like one thing, and none of it all worked very well. And
Right.
I ended up with like an internal bleed that led to anemia. It was like these medications
Right.
that was caused by a medication for the osteoporosis I developed like instantly, over the course of just like a year. I went from having normal, anyway, it has terrible side effects. Let's just put it that way. But all those side effects can be managed through things that I have control over. I have control over how much time I'm in bed, if not like my actual sleep quality. I have control over how consistent I am about when I get out of bed, when I wake up. And I have control over how much I move during the day and the timing of that exercise.
Right.
And just all the things that there's just so much research that shows that like I may not have what I need from an estrogen standpoint to regulate my blood sugar, but I can get my body to regulate it in a totally different way by
Hmm.
just doing a few squats after I eat or moving or standing up and moving around a little bit.
Yeah. So you were not seeing yourself as a passive body that was receiving traditional medicines, though they were helpful and necessary in some cases. But
Mm-hmm.
you became an active researcher and agent in altering your own behavior. You're studying this now. You're building for Sutter Health a research study
Yeah.
for breast cancer survivors. And what are you hypothesizing about the most important lifestyle changes? As the expert you've been in lifestyle change, you've referenced a couple. What rises to the top, Christine?
Well, I just want to broaden it out a little bit so the Sutter Health Research Institute is studying this coaching program that I've created,
Mhm.
and which is so fun. And they're studying it in 3 populations of estrogen deprived women. So the either women who are estrogen deprived because of medical menopause, basically. Those are the breast cancer patients. Anybody who's entered into Sutter's menopause program. So they're experiencing some of these symptoms anyway. And then physicians and nurses practitioners at Sutter who are experiencing moderate to severe menopausal symptoms are also. So these 3 different populations are all very interested in what they can do to manage these sorts of side effects. And the belief is that, like, whether if you have cognitive decline or diabetes or some sort of cardiovascular disease, like
Or
these life
osteoporosis
or
is,
osteoporosis or whatever, these sorts of lifestyle changes, there's so much research that they work really well alongside the traditional pharmaceuticals. And sometimes they work alone if there's no pharmaceutical that works. And
right.
certainly it like helps with everything. Like breast cancer recurrence drops by about 15%, not recurrence, death from breast cancer drops by about 15% for each increment of exercise per week that you do. Like it's completely quantifiable in terms of like how life-saving this stuff is. And it really applies to everyone. Okay. So you asked me what is the most
Yes.
important thing.
Yeah.
And I actually think the most important thing is knowing how to follow through on your best intentions. So I don't think that there's one size that fits all. Like I think we know that like exercise is really good for everyone in all conditions for sure, right? But if you're not sleeping well, like you gotta figure out your sleep first, because how in the world will you ever get yourself to exercise if you're too tired to like go about your daily life, right?
Right.
And for some people, they're so lonely or so depressed or so anxious that like you can't make a change, right? So I think the more important thing is to understand how these changes are made, right? Like how do we get into a healthy habit, right?
So
How do we
it's less the what of specific practices, eating, exercise, drinking,
Mhm.
whatever. And what
More
you're
the
saying is it's really the how of like, how do you commit to it? How do you stick to it? Is that right?
Yes. How do you follow through
Uh-huh.
on, I mean, people vary widely in terms of how much health education they've gotten. And
Right.
some people really don't know what to eat or that exercise is good for them. But I would say that, you know, for most people, the bigger problem is not about knowing what to do that would help. It's
Yeah.
about knowing how to get themselves to do it,
Yeah.
right? It's not
Yeah.
even how to do it. It's like how to get themselves to do it.
It's wonderful. The work you're doing is always so great. Christine Carter, author of Raising Happiness. So thanks for joining us in the sweet spot here of Diacardia. Totally grateful to you.
Thank you for having me.
Of course. Well, Dr. Christine Carter is a social scientist obsessed with data. She stunned me, as you might have seen, when she said Alzheimer's is reversible. Oh, sure. And there's pie in the sky, money grows on trees, I'm kind of thinking. But the data is the data, and that people paying attention to their lifestyle choices are reversing chronic diseases. We'll have her on again to talk about behavior change. How do we do it? How do we commit to changing our behavior? But in the meantime, let me know your comments on what you're thinking after listening to Christine Carter. Our second episode, scheduled with her, talks about how she dealt with cancer, her own cancer, as the researcher she is and the amazing person she is. I hope you'll check it out and enjoy it. This is Diacardia, the podcast for pairs who develop themselves and strengthen relationship by listening through the heart and by speaking through the heart. I'm Dan Mulhern.